The United States will replace most of its COVID-19 booster shots with updated versions that target the dominant Omicron strains and streamline its ongoing vaccination campaign, the Centers for Disease Control and Prevention announced Thursday. Under the new plan, Americans ages 12 and up will be asked to roll up their sleeves for the reformulated boosters, which are engineered to combat the BA.4 and BA.5 subvariants along with the original coronavirus that arrived in the U.S. in early 2020. The bivalent boosters could begin going into arms in a matter of days. People will be eligible for the new shots if it's been at least 2 months since their last dose. About 209 million Americans currently meet those criteria, most of them haven't received a shot in more than 6 months. The change was recommended Thursday by the Advisory Committee on Immunization Practices, an influential group of vaccine experts that provides guidance to the CDC. Dr. Rochelle Walensky, the agency's director, quickly accepted the group's advice. The two offerings, one from Pfizer and BioNTech for people 12 and older and another from Moderna for adults 18 and over, represent the first substantial change to the COVID-19 vaccine recipe since the country's immunization campaign began nearly 2 years. Original boosters that don't target BA.5 will no longer be available to those 12 and up. The updated COVID-19 boosters are formulated to better protect against the most recently circulating COVID-19 variant, Walensky said in a statement. If you are eligible, there is no bad time to get your COVID-19 booster and I strongly encourage you to receive it. The CDC also revised its accounting of vaccine doses. Going forward, Americans will be considered up to date with their COVID-19 vaccinations after receiving the bivalent booster, regardless of the total number of shots they received. I think this is a huge step forward in simplifying the recommendations and hopefully enhancing coverage, said D. People who've had a recent coronavirus infection are advised to wait at least 3 months after their positive coronavirus test or the onset of their COVID-19 symptoms before getting the new shot. President Biden and members of his COVID-19 response team have been touting the fall booster campaign centered on the bivalent vaccine.